Hi, I'm Dr. Chandra with Preferred Medical Group and want to share with you what we're doing at Preferred Medical Group to take care of all our patients in the midst of a pandemic, the coronavirus pandemic. I'm going to be honest with you, in 30 years of practicing medicine, I have never ever seen anything like this. I don't think anybody in our generation has seen anything like this. So I share your concerns. We're all afraid at some level and we're all concerned for ourselves, our families, and hopefully we're all going to get through this very shortly. And I want to share with you what we're doing at Preferred Medical Group. So we understand that it is our responsibility to take care of our patients. We are more than happy to be doing our jobs. And we take care of a very vulnerable population because we have both pediatrics and geriatrics, so the very young and the very old. And what we are doing is we are following the situation very closely. We are taking into consideration all the guidelines that are coming out of the CDC, the Alabama Department of Public Health, as well as the Columbus Department of Public Health, because we are a border town. And every day we are having staff meetings with all the doctors and our staff and trying to come up with measures that would be best to take care of our patients. So here are some key things that we have instituted. So firstly, we have segregated the hours. So if you have an abdominal pain, you have blood pressure issues, you have ADHD issues, depression, anxiety, all of those, you can come into our office and have an appointment from 8 o'clock in the morning to 3 o'clock in the afternoon where there are no respiratory cases. From 3 to 5, we're bringing in anybody who has complaints of cough, congestion, fever. And during these times also, we are trying to encourage people to wait in the cars as much as possible to minimize any contact with the other patients in the waiting room or staff. And staff will call you as soon as the nurse is ready and pull you back. Within the office, we have designated separate waiting rooms for sick patients and well patients. And we are intensely cleaning. So there's loads and loads of bottles of bleach going around, and in between every patient, we are doing bleached cleaning. The next big key point is testing. Everybody wants to get tested, and there's such a big shortage of coronavirus test kits. However, we have leveraged all our resources, and I have a small stash of test kits. It's really small, like maybe 5 or 6, and we're holding on to those and using them in a very judicious way for only testing people who are at very high risk. I'll be honest, we did test one of our patients yesterday because he said he'd gone to a conference and sat next to somebody who just returned from Italy, and he was very symptomatic. So if you have symptoms of fever and cough and breathing difficulty, we have a few test kits, okay? And in the greater Columbus area, again, very big shortage of test kits. I just spoke to a colleague of mine who's leading the effort at Piedmont, and she told me the same thing. There is no testing being offered to patients who are in the outpatient setting or in the emergency rooms.